A 78 years old man develops sudden onset abdominal pain almost immediately after passes a large amount of diarrhea. What is the most appropriate investigation? So there is definitive clue that a 78 years old man develops sudden onset abdominal pain and it occurs immediately after large amount of diarrhea. So what is the most appropriate investigation for this? And we have to keep in mind that when there is a large amount of diarrhea, single episode diarrhea, and followed by severe abdominal pain non-responding to traditional painkiller, so it goes favor the mesenteric ischemia. It is due to mesenteric ischemia. And so what we have to do investigation for this mesenteric ischemia? Here the options are abdominal x-ray, CT angiogram, abdominal MRI scan, abdominal ultrasonogram, and rigid sigmoidoscopy. So what is the best tool? So this point that the sudden onset of abdominal pain followed by forceful evacuation, it is a classical present of acute mesenteric infarction. So it is the acute mesenteric infarction. And what investigation we should do? We should go for the CT angiography. There is no other option. There is no role of ultrasonography primarily. There is no role of plain x-ray abdomen. There is no other option. Direct go for the CT angiography, which has sensitivity more than 95% of the diagnosis. And if we miss the diagnosis or if we miss this suspicion, then in this case there is a delayed diagnosis and increased morbidity mortality of the patient. So what happened here? In case of the acute mesenteric ischemia or AMI, there is a sudden reduce in the blood flow and there is mesenteric vasculation followed by infarction and necrosis. And it can affect small and large bowel, but most commonly it affect the small bowel due to occlusion of the superior mesenteric artery, because superior mesenteric artery is the most common involved artery. So the CT angiography, the test provide a considerable amount of structural and flow information. They require contrast and they are particularly useful in the setting of the bleeding as they are rapidly available and can be performed in the non-vascular radiologist. CT angiography, it can be done by any radiologist. There is no need of the vascular surgeon or vascular radiologist. However, the lack of the facility of the endovascular intervention in general, they don't provide a high enough resolution for distal arterial surgery. But we should directly go for the CT angiography for the diagnosis of the acute mesenteric ischemia. So what is the investigation? The investigation is the CT angiogram. Other options here such as the abdominal x-ray, it is not true because abdominal x-ray cannot give information regarding the vessel. Abdominal MRI scan, the MRI in the abdomen usually less sensitive because there is the bowel peristalsis movement, and for MRI scan there is more fixed tissue are well visualized. And abdominal ultrasound, it also gives very little information. Rigid sigmoidoscopy, we know rigid sigmoidoscopy, it goes up to the sigmoid colon, but the acute mesenteric ischemia, it commonly involve the superior mesenteric artery, and this superior mesenteric artery, it supplies the small intestine mainly. So the small intestine is not visualized by this rigid sigmoidoscope. So we should go for the CT angiogram.